if you will be asked to perform transfer technique and ambulation technique. So first, you're going to, of course, follow the procedure wherein you're going to introduce yourself to the assessor and then tell that you are from Megami Training Center Incorporated, and you're going to inform the assessor that you're going to perform transfer technique and ambulation technique. So after that, you're going to give the definition of transfer. So what is transfer? It is a safe movement of a person from one place or surface to another, and it is also the opportunity wherein you can train the individual patient to enhance independence. Okay, so there are purposes of transfer. First is this is to promote or permit patient to perform activities in different environment. Okay, and then second, it is also an opportunity to increase level of independence. And then third, this is to promote function of the respiratory and the cardiovascular system. Third, this is also to promote elimination, meaning you can encourage patients to have normal urination and defecation. And the last one is will prevent complications of immobility. So what are the complications of immobility? It includes muscle atrophy, muscle contracture, joint stiffness, bed sores, and pneumonia. Okay, so those are the purposes of transfer. So let's now proceed to the general procedure. So of course, first, under the assessment phase is you need to check if there is nurses delegation to perform the procedure. Then second, you're going to read the chart so that you will have an idea about the patient or you have information regarding your client, and also to know patients' vital signs, laboratory tests, and of course patients' latest health status. Okay, so after this, we're going to proceed to the next phase, which is the planning phase. So planning phase involves the preparation of the material. So since you will be doing transfer technique, you need to prepare the wheelchair and then the transfer belt. So considering maliw na kung towel, we will use the towel as a transfer belt. So please, you prepare. Okay, and then of course you have to prepare also some materials that you will be using during the transfer. You can ask the patient about the things that you're going to prepare for additional materials. Okay, so next will be after the planning phase. What is the next phase? Is the working phase. Okay, for the working phase, you're now going to first do hand washing before proceeding to the room of your patient, and then you're going to proceed to the room of your patient, knock the door 3 times to acknowledge your presence, and you need to open the door, then smile, introduce your name, and then the procedure that you're going to perform. So don't forget to greet also your client and the SO. And then you're going to identify the patient. So you can identify the patient through patient's hospital identification bracelet. If the patient can verbalize, you're going to ask the patient to state his name, age, date of birth, and address, and then compare it to the hospital identification bracelet. So after that, you are now sure that you are dealing with the right patient. So if the patient cannot verbalize, for example, you have to